So here we have 4 diseases. They are all together known as cardiovascular disease. Cardio means heart and vascular means blood vessel. So diseases which are affecting either heart or any part of the blood vessel can be called as a cardiovascular disease. And the first we have to understand what is the meaning of that. As I told you, these are a group of disorders which will be affecting either heart or the blood vessel. And importance of cardiovascular disease is that they are a leading cause of death. Most of the time we know that among our relatives and families, most people are dying either because of heart attack or stroke, etc. Stroke is a leading cause of death, especially in Kerala. So that is why the cardiovascular diseases are studied in detail. And most of the time we can see that these diseases are associated with the lifestyle of the person, how we are living. And there is also some genetic connection, especially if the father of a person is having a heart problem. There is a higher tendency that children can also be affected by heart-related disorders. And there are also environmental factors which are responsible for the development of these disorders. And here we can see that some of the major type of cardiovascular disease include hypertension, that is a blood pressure, and atherosclerosis and stroke, and also the chronic obstructive pulmonary disease. It's a lung disease. And about these 4 diseases we will be discussing now. The first one is the hypertension. You know what is a hypertension? It is an increase in blood pressure. Normally we have a blood pressure of 80, between 80 and 120. 120 is the systolic pressure and 80 is the diastolic pressure. Higher pressure and lower pressure. And if the pressure of the person is above this 120, and if it is reaching above 140, we call it by the name hypertension or high blood pressure. So one problem with the high blood pressure is that because of higher blood pressure, that will be damaging your very smaller capillaries. And when capillaries are affected, that will be leading to the destruction of your kidney, sometimes destruction of the lungs, and different parts of the brain can also be affected. So that is the problem of hypertension. And what are the factors which are responsible for hypertension? One is the high salt intake. So if generally in our state we are all eating rice. Now here there is a practice among many families, among many people, like putting salt at the time of eating rice or chor. And this is a very unhealthy practice which should be stopped, because generally a healthy person can take only 8 grams of salt. And in your curries also you are putting lot of salt. So if you are putting additional salt into the rice while eating them, that will increase the salt content of your food. So during the younger age, it won't be creating any much problem. But after an age of 40, if you are still continuing with this practice, that will be increasing the amount of salt that you are taking. So a person with blood pressure can only take around 2 grams of salt in a day. But a healthy person without blood pressure related problem can take up to 8 grams. So when you are having a blood pressure related problem, you have to reduce your salt intake by nearly 75%. So that is the thing. So high salt intake can be considered as an important reason for higher blood pressure. The problem is that more salt in your body, more amount of water the body will be retaining, and that will result in higher blood pressure. The second factor that is responsible for high blood pressure is obesity. Obesity, as you know, increases the weight. So obesity is a major problem. Then sedentary lifestyle, not walking much, most of the time sitting and doing the work. And nowadays we are working with the help of a computer, or you are now earlier children used to go outside. Now what people are doing, and you are taking mobile and working with the mobile, or playing with the mobile, or talking with the mobile. That is what most of the time people are doing. But when we are students, when we are children, we used to do a lot of physical games like badminton, shuttle, football, etc. So we used to get a lot of exercise, and we people are not getting that. There are no playgrounds also here. So that also is contributing to sedentary lifestyle. Then another is stress. People are having stress, especially stress is everywhere. Now this is the most stress-free period for you. So once you are outside the college, once you enter into an occupation, into a job, you start having stress because everywhere they give you less money, they give you more work. That is how the stress is coming. So stress is a major problem in today's occupation. There are very few jobs which are not very stressful. But most of the time, especially if you are in the banking sector, last time Kerala government has published some report on stress levels of among employees of Kerala that was submitted to the chief minister and was shown in TV. And they are saying that people working in IT sector, people working in banking sector, they are having the highest stress among different types of employees. So stress is a major problem for many people, and if you don't know how to manage stress, then that will be going to reduce your lifespan tremendously. Then genetic factors. As I told you, if the parents are having hypertension, you should be very careful. There is an increased chance for you also developing the same thing. Then smoking and alcohol consumption. Smoking is a major problem, and that is increasing also not only in India, outside India. If you go to when I am traveling to different countries, especially if you go to the many foreign countries like Australia, or if you go to Vietnam, etc., people are smoking. Too many people are smoking. There are more than the people who are smoking here. So that is also then alcohol consumption. Alcohol consumption is also increasing. So our government is also selling alcohol for the government. Alcohol is a major industry. Without alcohol, the government cannot function. So that is also a problem. Then another problem is the symptoms of is regarding the symptoms. I want to change this into a different. Okay, so here you can see that other than the symptoms of the blood pressure, one important problem is that it is considered as a silent killer. It is asymptomatic, no symptom. So if you have a blood pressure of 160, your body is not going to show any symptom. You are absolutely fine. And if when somebody says that you are having blood pressure, you are not going to believe it easily, because blood pressure is not going to show any immediate symptom. The main problem with the blood pressure is that more pressure is coming in the blood, and what happens is that weak blood vessel, especially smaller blood vessel, capillaries in your blood, in your body, that will rupture, especially capillaries in your kidney. The kidney is having very fine, very much smaller blood capillaries which are responsible for filtration of your blood. They will be gradually dying, they will be destroyed, and over a period of time what happens is that your kidney may not be working, and that will lead to total kidney failure. Then the only thing you can do is that either go for what is called dialysis or go for complete kidney replacement. So the one problem with this heart blood pressure is that it doesn't show any symptom. Another is that too much of headache, higher headache can always show as a headache. Headache will be there, dizziness will be there. Your vision can be affected if blood pressure is more. Then in some cases nosebleeds, blood coming out of your blood. So these are all indications that the pressure of the person may be higher. Then what are the complications? Complications are here. We can have a higher chance of heart attack. You can have a higher chance of stroke. Then damage to the kidney is the primary problem with the higher blood pressure. Then aneurysm, bulging of the blood vessel. So these are all some of the problems which are associated with the higher blood pressure. So what we can do, there are two things that you can do to manage. One is modifying your lifestyle, especially your diet. Take less salt. So if you are taking too much salt, as I told you, putting salt into the rice can be a very unhealthy practice. Do a lot of exercise. Then another thing is then manage how to keep calm, how to be happy, how to be in a relaxed mood. That is also very important. Even if you don't attain great success in your life, if you know how to be happy with the limited resources, then you can be a happy person. Then medication. Some of the medications like AC inhibitors, beta blockers, diuretics, these can also increase the your blood pressure level. So this is an idea of what he can do. Sometimes the medicines you are taking can be responsible for increased blood pressure. So that should be monitored and it should be reduced. So this is an idea of what is high blood pressure and how blood pressure can be a leading cause of death. Now we go to the second one. The second one is about atherosclerosis. You might have studied about atherosclerosis sometimes. It is simply the thickening and hardening of arteries. The arteries in your blood vessel that will be getting more harder due to the accumulation of plaque, because the cholesterol or fat particle get deposited on the inner side of the blood vessel, and what happens is that they become more harder, and it won't be the elastic nature of the blood vessel will be lost. So that will be resulting in hardening of the blood vessel. So when hardening of the blood vessel is taking place, what happens is that will be contributing to increased blood pressure. So that is also a problem. So it leads to reduced blood flow and increases the risk of heart diseases. Now, what are the major causes of atherosclerosis? Here you can see there are 4 major causes. One is high cholesterol level. How high cholesterol level is coming? Eating too much fat. So if you are eating too much amount of fat, that will be leading to high cholesterol level. High blood pressure is also a responsible factor. Then smoking is a factor. Smoking, many of the chemical compounds which are present in the smoke can directly and indirectly contribute to higher blood pressure. That is also a problem. Then we have diabetes. Diabetes can be a problem because diabetes is a disease that can affect any part of your body. So controlling the diabetes is an important thing because it has an impact on every system in your body. Then we have inflammatory conditions. That is also leading to that. So what are the symptoms of atherosclerosis? There can be heart pain or chest pain, which is popularly known by the name angina. Angina is the heart disease. Then shortness of breath. You may not be able to breathe properly, especially when you are climbing, walking, etc. You may feel a shortness of breath. Then weakness in your limbs. That is also a problem because when you are walking, you feel that your legs are not very strong. Your legs are very weak. You are going to fall. So all this will be a cause of peripheral artery disease and also contribute to atherosclerosis. Then what are the complications of atherosclerosis? It can lead to heart attack. That is the main problem with atherosclerosis. It can lead to stroke. Stroke is the damage. What is stroke actually? Rupture of blood vessel inside your brain is known as a stroke. Then peripheral artery disease. Some arteries in especially in your lower leg, they can bulge or they can rupture. There can also be a problem. Aneurysm, bulging of blood vessel. So these are some of the complications of atherosclerosis. And here finally we can see what are the techniques that you can do to manage this. One is healthy diet, low in saturated fat, eat less fat. Like if you are taking lot of milk, lot of fat, lot of butter, lot of chicken and lot of meat, etc. All these will be rich in saturated fat. So reducing the intake of fat, especially meat and chicken. But if you are eating a lot of fish, there is not much problem. Fish contain lot of unsaturated fat. Eating the chicken, meat, etc. and eggs, etc. are the primary cause of increasing in your fat. And anything that you are buying from your bakery also, they also contain lot of saturated fat. Then eat plenty of fiber. Fiber means one problem with our diet is that we do not have taken a lot of fiber. But if you are taking a lot of nuts, like this almond, etc. If you if you don't have that habit of eating nuts, try to develop the habit of eating this almond, etc. or other kinds of nuts. These nuts are all rich in fiber. So nuts can they have a lot of medicinal properties also. It beneficial health effects also. So if you are taking a lot of fiber, that is good for you. Then regular exercise. This is something that you can practice right from your age onwards because it keeps you healthy. Then cholesterol lowering drugs. That can be also responsible for because every drug has some kind of problem. So if you are taking cholesterol lowering like statins, different types of drugs are there. They are also not very good. Then blood pressure control. So that is also something that you can do to reduce the chance of development of atherosclerosis. Now third disease is known as a stroke. So stroke occurs when blood supply to the brain is disrupted due to blocked or ruptured blood vessel. That is, one part of the blood vessel that is supplying blood to your brain is not working. It is not pumping blood to that part of the brain. And what happens is that that part of the brain is getting dead. So when a part of brain is getting dead, that is known as a stroke. And part controlled by that part of the brain will not be functioning, will not be showing any kind of response also. That is why when people are having stroke on left side, right part of the body may not be working. When they have a stroke on left side of the brain, they may not be able to speak, and the right part may not be working. So this is how stroke is also affected. Now basically we have two different types of stroke. One is ischemic stroke. And ischemic stroke is actually caused by a blood clot blocking an artery. That is, in an artery, small blood clot will be coming, and that will be blocking that is known as the ischemic stroke. If you have a doubt, I will show you how the ischemic stroke is. Here I will show you a picture of how ischemic stroke. See, this is the ischemic stroke. See, so this kind of block, see here, this is a ischemic stroke. So a small blood clot can happen inside the blood vessel, and that will be leading to the that will put the brain in a situation that one part of the brain may not be getting any blood supply, and that part of the brain will be dead. So that is known as the ischemic stroke. Then we have another type of stroke known as hemorrhagic stroke. There is a hemorrhagic stroke, blood vessel will break or blood vessel will rupture, and leading to loss of blood into the brain, and that there then also some cells in your body, in your brain may be damaged, and that also leading to leading to a situation in which that part of the brain may not be working, and the part affected controlled by the left side or right side of the brain may not be showing any response. So what are the causes of stroke? One is hypertension is a major cause. Atherosclerosis is also a responsible factor. Then diabetes, smoking, atrial fibrillation, irregular heartbeat. So that is also a major problem of the stroke. Then what we can do, what are the symptoms of stroke? Usually what happens is facial dropping. I will show you how to, if somebody in your family is having a stroke, you can immediately identify. See, face dropping. See here, this is a very good. See, normally this is what is happening. See, you look at this person's face. See, normally when a person is having stroke, the lips of the person may be something like this. So this is a very sure sign that the person is having had a stroke. See, there is one side of the lips will be normally in an inclined way. So that is a sign that the person was affected by stroke. So here I will show you another picture. See, this person had a stroke. See the lips of the person was slightly in a tilted position. That is a sign that the person had a stroke. So this is the best method by which we can all identify that person had a stroke. So dropping face, dropping. So dropping face. See, eyes also has some problem. So the best identifying factor is a dropping corner of the mouth. So if you feel that the mouth of the person is slightly tilted in this way, remember that it could be a sign that the person may have had a stroke. So in such cases, what we can do, take them to the hospital at the earliest. Then facial dropping is an important symptom. Arm weakness, that is another. Then the person may not be able to speak anything. So that difficulty in speech, time to seek medical help. Then complications are there. What are the complications that which are associated with the stroke? One is paralysis. Normally, in case of any stroke, the body may be having a paralysis, especially if the left side of the brain is affected. That will lead to loss of speech, loss of body movements on the right side of the brain. That means he or she cannot make any movement with the right leg or right arm. But other part of the body may be okay. Then cognitive impairment, that is the intelligence of the person may be damaged. And after a period of time, most of the time, if the person is not recovering from stroke, it will lead to death of the person. But one important advantage of the stroke is that even though the stroke is very damaging, especially for the people after a period of 70 or 80, stroke can be most of the time can lead to death. But for a person in the 50 or 60 or up to 70, they can still recover because brain cells may be regenerating after a period of time. So even though the stroke may have caused some temporary paralysis, maybe after 6 months, after a few months, sometimes after a period of 1 year, they may completely recover from the symptoms of the stroke. Then what we can do in the use of managing the stroke, we have ischemic stroke. Ischemic stroke, what we do is that they are primarily caused by clot, and what we do that we will be giving injection of clot dissolving drug known as thrombolytics. So that is the responsible ischemic stroke. Then hemorrhagic stroke will be there. Hemorrhagic stroke means the blood vessel has ruptured and there was a leaking of blood into the brain cavity. The only thing we can do is that we have to go for immediate brain surgery. Then rehabilitation. One is physiotherapy. So physiotherapy is that we have a lot of physiotherapy centers now mushrooming in different parts of Kerala. That means many people in Kerala are actually affected by stroke. Then speech therapy because when speech difficulties are there, the person may not be able to speak properly. So speech therapy can also improve. Then other thing is the fourth disease is the chronic obstructive pulmonary disease. It's a lung disease actually. It's a lung disease that causes obstructed airflow, making breathing difficulty. So the person may not be able to breathe properly. There is a blockage within the lungs. Then what are the causes? Long-term exposure to cigarette smoke. Most of the time smoking is the primary factor responsible for COPD. It's a very dangerous disease. Then air pollution, especially if you are living in cities like Delhi, Mumbai, etc. or Beijing, etc. They have a high pollution, and high pollution can lead to COPD. Then genetic factors, an increase in alpha-1 antitrypsin deficiency, they can also lead to COPD. Then chronic frequent respiratory infection. Frequent respiratory infection can also be lead to COPD later. So these are some of the major causes of COPD. Then what happens to what are the symptoms of COPD? In the case of COPD, one is shortness of breath. So I will show you about how COPD is actually creating problem. So these are some of the major problems of COPD. See here, you can see that. See, so in the case of a COPD, this is how the normal trachea or bronchus will be looking like. When COPD is there, the inner diameter may be reduced. So that is what is happening in the case of COPD. So less air will be reaching the lungs. So the person may feel a shortness of breath. So that is the problem with the COPD. The lungs are damaged. So shortness of breath, chronic cough with the mucus, then there will be wheezing, fatigue, etc. Person may feel very tired. Then what are the complications of COPD? One is respiratory infection. Frequent respiratory infection, heart disease can develop, pulmonary hypertension can develop, respiratory failure can develop. So the COPD is a very dangerous disease. Sometimes it results in the lack of damage to lungs, severe damage to lungs. So what we can do to prevent COPD is that smoking is the primary factor that is responsible for COPD. Then you can use inhalers, bronchodilators. Certain drugs are there. If they are inhaled, that will be containing certain gas which will be helping to dilate the bronchus. So bronchodilators can be used. Then pulmonary rehabilitation, that is another technique. Then giving them a lot of oxygen. Oxygen therapy can also be used in case of COPD. So COPD is a dangerous disease that will be reducing the diameter of your blood vessel, diameter of your bronchus and trachea as well as bronchioles. So that will be resulting in reduced airflow into the lungs. That is how the COPD will be developing. So this is an idea regarding 4 different diseases: chronic COPD, then stroke, atherosclerosis and hypertension.